Find out which exercises are bad for scoliosis. When patients have a diagnosis of scoliosis, a lot of times they're looking for exercises, and one concern is there an exercise that they're doing that could possibly harm them or be bad for them? When we look at patients with scoliosis, we know that every case is very unique, and there's a wide severity of the range that we're dealing with scoliosis. And sometimes scoliosis patients can have a difficult ability to move in certain directions. So when we look for scoliosis exercises or exercises for patients that have scoliosis, we're looking for things that can help improve flexibility in specific directions, normally directions out of the curvature. We're looking for exercises that help kind of improve the range of motion in what we call the normal spinal rigidity that we see associated with scoliosis progression. We're also looking for exercises to help create a healthy body, because we know the healthier a person's body is, the more responsive they are to treatment. So this general health exercises are very important, because the more fit somebody is, the more we can use their fitness to help reduce their curves so they're more responsive to the care that we can provide. And then, of course, we want them to have a relatively strong center of their body: core, abs, low back, and spinal muscles. Normally, the stronger these muscles are, the more we can utilize them to help use those specific spinal exercises or scoliosis exercises to help create more spinal support and help correct the corrective nature. But one big question I always get asked, well, is if I can do just some exercises, can I help reduce my scoliosis? Like, is there an exercise, a general exercise that can help reduce it? Let's say like swimming or yoga or playing tennis or with a certain hand or doing a certain type of activity, some kind of general exercise that can help treat or reduce my scoliosis. And the unfortunate answer is no, that exercise alone, especially just general exercise, doesn't have a corrective potential when it comes to scoliosis. Now, it may be in a very small curve, 5, under 10 degrees, like maybe not even considered scoliosis. But once you start getting 15, 20, 25, 30 degrees, we know that general exercise alone is going to have hardly no effect. Now, scoliosis-specific exercises are exercises that are prescribed by somebody who understands scoliosis, by a treatment provider that understands how to prescribe these exercises, and they're normally based upon the curve that you walk in with, and also your ability to reduce that curve with motion. These are called scoliosis-specific exercises, or SSEs. These scoliosis-specific exercises have a greater potential of helping manage and reduce a curve, but normally they're done as a facet of multiple treatments. So we know what exercises are good for scoliosis are these specific scoliosis exercises that are prescribed by a treatment provider. And normally the doctor or the provider will work with the patient to make sure they're moving exactly into the correct position, to make sure they're having a corrective effect on the scoliosis. And when we look at these scoliosis-specific exercises, they have the most or the greatest effect on patients with scoliosis. But if you're looking for general exercises, what are some things that you can do? Well, the less compressive the force or the exercise could be, the better it's going to be. So walking, cycling tends to be good. Certain swim techniques can be okay. Things like yoga and Pilates can be okay for general exercises, but these are not going to have a big effect on reducing the curve, but they could help you with your overall health and well-being. Stretching type of exercises that are associated with yoga and Pilates could have a good effect on patients that have scoliosis, because they can help improve their flexibility, help them feel better, help them feel long and elongated. Those are also good approaches, but again, they're not necessarily directed to help reduce a curve. Which ones are particularly bad when it comes for scoliosis patients? Which exercises are that they should not perform? Things that overuse one side of the body, especially overuse the side of the body that would increase the curvature. So movements or motions that are one-sided that increase the curvature could be very bad as well, or can increase the rotation of the scoliosis. So things that I could think of is like tennis or golf or things that are or bowling can be very affecting on that particular part of the body, and could be possibly affecting the size of curvature, because if it's done on the same side over and over again. Repeated jarring motions, like horseback riding is a very common example. Horseback riding can have a common compressive effect on the scoliosis, which can lead to aggravating the condition. Things like constant jumping or gymnastics, where there's constantly a compressive force, Collision sports like football, where you're constantly having compressive type of collisions or injuries, could help, unfortunately, help progress the scoliosis problem. And last thing is repeated hyperextension of the spine. I believe this is probably the most effective movement that could possibly lead to progression. A lot of flattening of the mid back. The most common sport or activity we see where they teach a lot of flattening of the mid back is in gymnastics and in dance, things like ballet, because they teach this forward chest position, and that forward position flattens the mid back, which can lead to progression of scoliosis. We understand that scoliosis is not a curable problem. No matter what treatment method that you use, we're never going to totally cure scoliosis. We're not ever going to completely correct scoliosis. Even if we reduce the curve to 0, let's say, whatever caused the scoliosis, we still don't know because most causation is unknown or idiopathic in nature. So we're always knowing that there's a potential of the curve kind of either coming back at some level, so we're always managing it. And we know most of the time scoliosis is a progressive structural spinal problem, that it's going to progress over time, and it's going to progress either rapidly during growth or slowly as an adult due to gravity. So since we know we can't cure it, we can't completely correct it, we're always trying to manage it. It is very manageable. The smaller the curve, the easier it is to manage. The younger the patient, the easier it is to manage. And exercises are a component to the management system. And we break down those exercises into 2 general categories. General exercises for health and fitness. The healthier you are, the better you're going to respond to any type of functional treatment that you choose. And then scoliosis-specific exercises that are designed specifically to help the patient get into a corrective position using their own muscles and tissues to help reduce or manage their scoliosis progression. But never, in most cases, is exercise alone a corrective measure. It can help assist in other things that you're using to help complement other treatments that you're doing to help reduce or manage the scoliosis. But exercises alone normally don't have a corrective potential, especially when you're looking at curves over 25 degrees. It's alone, it's not going to have a strong corrective effect. But combined with either really good therapy and rehab and office treatment, like we do in Scoliosis Reduction Center, or combined with very corrective bracing, like we do in Scoliosis Reduction Center, or combined with both of those and doing scoliosis-specific exercises, that combination can provide a very strong effect to produce a good outcome in reducing the curve and stabilizing the curve so there's no further progression leading to further problems. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.